Good evening. Good evening, everyone, and thank you for attending the Urban League of Portland's combined Meet the Candidates Forum. Tonight we're doing a combined forum for two different districts for Multnomah County Commissioner. My name is Julie Delgado. I'm the Vice President of the Urban League of Portland, and I'm going to be tonight's moderator. So before we get started, of course, on behalf of the Urban League, I just want to thank all of our community partners for supporting tonight's forum. This is really a collaborative community forum. Where we solicited a lot of feedback from the community and our constituents, and so we're just very pleased that it could come together. Tonight, we're featuring the candidates that are facing runoffs for county commission, which is just kind of an interesting civic note in Portland politics. So tonight we have with us for Commissioner District 1 is, I'm going to say, yeah, District 1. I'm just going to stop saying Commissioner now. For District 1, we have two candidates, Megan Moyer and Vadim Mazurski. I'm so sorry. I practiced it and everything. And then in District 2, we have Sam Adams and Shannon Singleton. Tonight's candidates are here to highlight their campaign proposals and answer questions that came from our community. For tonight's event, each candidate will kind of deliver an opening statement, then we'll have questions that again are from the Urban League, and then a closing statement. This is a forum, it's not a debate. So we hope it's super exciting and informative, but it's also just going to be incredibly orderly and respectful. We say here every time that any defamatory, abusive, profane, threatening, offensive, or hate speech would obviously be prohibited. We don't anticipate that being a problem, but of course we want to be transparent about our rulemaking process. So candidates that would engage in any type of behavior like that would be removed from the forum. I'm going to go over the ground rules for our audience at home, but you all have received these in advance, which is basically to please remain muted if you're not answering a question. This really helps us with audio, but also for video focus. Like right now I'm talking, so I'm in the center. But as you talk, you'll be in the center, and we want you to be the center. You'll have 2 minutes to deliver an opening statement. When questions are asked, each candidate will have 2.5 minutes to respond. So we have 4 questions tonight, so you have 2.5 minutes to answer each question. Everybody will have 2.5 minutes. After the questions are complete, candidates will have another 2 minutes to deliver a closing statement. Please be courteous and conscientious of time. We want to keep this tight. We want to give everybody the same opportunity. So throughout the forum when speaking, if you are within 30 seconds of your allotted time, we're going to use the chat to send you a notification. If you go over time, we'll let you know like time is up. And then if you keep on talking, you'll be muted. It's so awkward. I've watched all of these. I hate that. So please try to be mindful of the chat, have it open. It's like, it's the other candidates find it awkward too. Nobody wants to like jump in because it feels like you're interrupting. So those are the ground rules. Again, I really appreciate the candidate, all of you candidates for being here and for taking time to speak to our community. We're really delighted to have you. So we're going to start with opening statements, and I'm going to start with former Mayor Sam Adams. So you have 2 minutes to introduce yourself. Your time begins now.
Great. Thank you for the opportunity to be here and for putting together this forum. Despite having some great staff, despite having some really talented leaders and really very productive community partners, too often Multnomah County lacks urgency, it lacks focus, it lacks good partnershiping, and it lacks accountability. And I'm running to take the years of work of bringing people together in city government to tackle big bureaucracies and take on tough issues to get the kind of changes that we need, and we'll talk more about in the Q&A at Multnomah County. I also bring with my candidacy with the deep roots in city government, the ability to get the city and county working better together on especially their shared issues of human wellness, which includes homelessness, and also on the issues of community safety. So again, glad to be here.
Thank you so much, Sam. Next, we're switching over to District 1. Megan Moyer, you have 2 minutes for your opening.
Hi, I'm Megan Moyer, and I'm running for Multnomah County Commissioner in District 1. And I came to the decision to run out of frustration. I really felt like we were in a crisis moment with untreated untreated substance abuse, mental illness, and a serious homeless crisis. And unfortunately, our county has not been able to step up and provide the necessary services that people need in order to successfully leave homelessness and move on to stable housing. And as somebody who advocates for people with disabilities, including mental illness and other disabilities, I know that our homeless population, 80% identify as having a chronic disability. That's from the 2022 moment in time survey. And so in order to be able to help people be successful in leaving our streets, we have to be able to help support their disability or access to treatment. And unfortunately, we do not have a functional mental health and addiction system. I've been working on building services for 20 years in Oregon. I have a lot of background in how do you use programs like Medicaid and other partners in order to deliver the services we need. And I really was drawn to running because I know that these are fixable problems, but we cannot wait any longer while people are dying on our streets.
Thanks so much, Megan. For District 1, Vadim, it's your turn for an opening statement. You have 2 minutes. You're still muted. I'm sorry, but thank you for being so muted. But now's the time to unmute.
Thank you. Well, thank you very much, everybody. My name is Vadim Mazursky. I'm running for the Multnomah County Commission, District 1. Vadim is not your typical name. My parents arrived here from the Ukraine about 45 years ago, my parents and I. We came here not knowing any English. My father took odd jobs to put food on the table. My mother went to community college and became a nurse. And we moved around a lot. I know what it's like to need some help from time to time. We were lucky enough to help people who gave us loans for our first car, help my father get odd jobs until his English improved. Now I'm here to help other people that need help. A lot of them are on our streets. We're at an inflection point here in Multnomah County. There's lots of really nice things happening. Concerts in Goose Hollow brought 30,000 people to Central Portland. The Albina district is being redeveloped. In Old Town, we're seeing a new arts center. Downtown, a new performance arts center. The OMSI is being redeveloped. But we need to fix the crises that we've been having in Multnomah County. And that crisis is because we haven't had people on the Multnomah Commission that have been able to work together. We've lurched from a housing emergency to a homeless crisis to a high crime rate and murder rate, methamphetamine crisis, fentanyl crisis. I'm here to stop that chaos and bring a period of pragmatic calm to local politics by running a more efficient and honest government. And so we need to address the inequitable high costs of living and taxation so that people and businesses don't flee Multnomah County. We need job growth and housing construction. We need accountability in our government so that you know that your dollars are being put to good use. And we need to make our neighborhoods safe so that no one has to worry about being out late or having their kids play out in their neighborhoods. I will do that in Multnomah.
We ran out of time for the 2 minutes. I try to have the chat open so that you see hey, you're running out of time notification. Thank you for your statement though. Shannon Singleton is we're back at District 1 or we're back at District 2 now. I'm gonna not get that confused again. We're back at District 2. Shannon, please begin. You have 2 minutes.
Thank you so much, Julia and the Urban League team for putting this on for us. My name is Shannon Singleton. My pronouns are she and her, and I'm running for Multnomah County Commissioner for District 2. And I'm running because the county is the largest social service agency in the state, and it is long past due time for somebody with experience and a track record of results to serve on this board. And I'm that candidate. I have personal, educational, and professional experience on the front lines of the issues that the county addresses. I know what works, where the gaps are, and how to fill them. I grew up in Philly with a single mother raising 2 kids, working multiple jobs, and who often had to choose which bill to pay. She also would very regularly bring people in our house who were struggling to make ends meet and had no place to live. So I was raised to understand that community takes care of each other, and I went on to study social work in college. I spent almost 30 years of my social work career moving people into housing, providing treatment, and creating programs and policies that push against the status quo and the systems that have failed far too many of us. I'm running because it is time for us to move past the politics of division and chaos and to turn the page on politicians pointing fingers at each other. It's time to elect a collaborative leader who is ready to get things done and move us forward with transparency, accountability, and hope. Thank you.
Thank you so much, Shannon. Thank you all for your opening statements. We really appreciate it. So we're now moving on to the question portion of the forum. For each question, each candidate's going to have 2.5 minutes to respond to each question. We're going in alphabetical order. I'm going to try to remember to say your districts because I actually realize that might be confusing to the you're not, you know. So I'm going to say your district, then your name, then you'll start speaking, just to make it more viewer friendly. So questions now. The number of deaths in the Multnomah County Jail has spiked in the last 2 years, sparking more than 400 recommendations for improvement, which have been issued by the sheriff, county, state, and federal agencies. Black county residents are arrested at a rate roughly 4 times the proportion of the population, increasing their chances of being housed in a county jail. How will you ensure the health and safety of all persons held in Multnomah County jails? And so we're flipping now and going reverse about alphabetical. I forgot to say this part. We're going to go reverse up. We're going to go back and forth. Guilty. It's a wild ride. So Vadim, you're first and you have 2.5 minutes beginning now.
Oh, thank you very much. It's an excellent question. We've had a lot of problems in our jail system. There's no question about it. You've touched on several, including racial disparities, as well as the high rate of people dying in our jails. What we need to do is make sure we have adequate staffing levels, especially psychiatrists and people that are there to help the individuals that are in our jail system, make sure that they are successful in rehabilitating, but also make sure that they're successful in addressing whatever ailments, impairments, drug addictions, or mental health needs that they may have while they're in the county jail. We've had a lot of turnover in the county jail. We need to make sure that we fix those errors. And that includes errors in the management structure as well, that people are accountable. And I've been running on a promise of holding our government accountable. That makes sure that the people that are working for the county, the people that are working in the jail system for the county are held accountable for results, that they're not leaving people behind, that they're not missing very important issues that need to be addressed, and that they're helping the individuals who are housed in our jails to be successful when they come out of the jail system. And that takes transparency. And so you will see from me dashboards and information about how many people we have, about what services are being provided, about what sort of care is being provided so that people are successful in addressing their needs while in the jail system and when they get out of the jail system. Thank you.
Thank you. Now we're going to Shannon Singleton, District 2.
Thank you. And I just want to start by appreciating the Urban League and Imagine Black and other community organizations who really pushed for charter reform to include adding the responsibility for county commissioners to start inspecting the jails. So I really want to utilize that new power that we'll have to be in there and see firsthand what's going on so that we can be really making informed policy and budget decisions. What I'm hearing from the folks on the front line, and particularly our nurses in jails, is that they continue to face understaffing where they don't have the ability to provide the care that they need for the acuity that they're seeing of their patients, whether that is physical or behavioral health care. So I really want to start there and ensure that we can provide the amount of safety and treatment for folks who are currently in the system. But I think it's really, again, looking at those 400 recommendations as well as what we see with our own eyes in those jail inspections and using those to turn around good policy, as well as, again, budget investments to be sure that we're addressing the needs of those of our community members who are in that system.
Thanks so much, Shannon. Now we're going back to District 1. Megan, no, I screwed up. We're still in District 2. I'm so sorry. We'll just stay, listen for your name, I guess. We're going to actually to Sam Adams, District 2. You'll have 2.5 minutes. I apologize.
Yeah, I'm having had the opportunity to meet with some of the staff currently working in the jail and reviewing the audits, but hearing in their own words just how difficult of a situation it is. The jails, the holding center downtown, and then also the jail out closer to the Columbia River. It has, and the 400 recommendations that Shannon mentioned need to be taken seriously. When I met also with the sheriff and her team, the sheriff, the Department of Health provides a lot of the services in the jail that is not under the direct supervision of the sheriff. And so the sheriff relies on the Department of Health. And I think some of the recommendations sort of, if not out and out, say that the sheriff should have more, and the folks that she hires and puts in place to run the jail should have more supervision over, matrix supervision over the Department of Health employees. There certainly needs to be a lot more communication and a lot more cooperation. But I'd add to what's already been said is when you read through the audits time, sort of underneath a lot of this is the inability to attract talented staff and to keep them. It's a very difficult job, and the pay is, in my mind, dreadfully low. So we're not able to attract the kind of talent we seek, and we're not able to maintain it. So it's a serious issue, and I would like to see, and right now the sheriff has been trying to staff up the additional HR professionals that she was given to staff her part of it. And the wages, she says, are too low to attract the kind of talent and to retain the talent. So wages, benefits have to be much more.
Okay, looks like we reached time there. Thank you very much, though, for your response. And now we're moving to District 1 with Megan Moyer for your response. You have 2.5 minutes.
Sure. This is an issue that I've actually been, and not just me, the organization. My day job is I'm the public policy director at Disability Rights Oregon. And one of the things that our organization is tasked with doing, we have some federal authority to investigate when a person with a disability dies in custody. And so we have looked into several of Multnomah County's deaths, as well as deaths in Washington County, and all over the state, truthfully. In fact, there's a very good report by Disability Rights Oregon about jail deaths. And one of the things that I think is really, really important to draw a crystal clear line is jails are necessary for public safety. They are not a very good or conducive place to have a positive intervention for somebody's life. It is particularly dangerous to have people with untreated severe mental illness in jails. It often exacerbates their symptoms. Their behaviors often result in being isolated from others, which can have its own very unique challenges. Staffing needs for individuals with serious mental illness are a lot higher. And it's really not what jails do best. And it's not an appropriate intervention for situations that could better be treated at a hospital. And so I draw that distinction because I think people think, everybody who's getting arrested is being arrested for a violent crime. That's totally untrue. And I think we've got to make some of these decisions about what is the right intervention for people. And, sleeping on a park bench should not get you time in a jail, but that has absolutely happened in Multnomah County. And people die when we don't appropriately know how to support what is a disability. And so I am very concerned about increasing our jail population, particularly with vulnerable individuals, and having absolutely no plan of doing that safely and humanely.
Cool. Just in time. Thank you. Thank you all for your responses to that question. No, am I about to move on? I'm doing terribly at following the script, guys. So the last one is about HB4's next one, and not the last one, is about HB 4002, HB 4002, which was a ballot measure. No, it was overturning a ballot measure, essentially recriminalizing possession of small amounts of drugs. And it asked the county to identify strategies for the deflection for offenders. So this will be kind of new and pretty key for who's ever elected into these two positions. So key to deflection plans is data such as tracking demographics, disparate impacts, and outcomes. If elected, what information would you most prioritize in evaluating deflection programs, and how would you incorporate that information when changing policies? We're going to start with Shannon Singleton. Shannon, District 2, you have 2.5 minutes to speak.
Thank you. So with this one, when I think about information I've used to prioritize evaluation and deflection programs, I keep asking, what are we deflecting people to? We really need to look at the larger system. We have a lack of treatment beds in this community and frankly across the state. And so what are we doing to ensure that we can have places for people to go when they need more than just a sobering night? They need longer term treatment, whether that's transitional recovery housing, and or if they want to connect and can do outpatient treatment. How are we making sure those pieces happen? And I think to the point of the demographics, it's also disaggregating that by some of these different demographics. So I want to know if certain communities are being pushed towards certain services that may not be what they're asking for. I want to know how much are we actually doing what folks are showing up and saying they need. And I also want to know on the long-term outcomes. We tend to track things just from, okay, that person got into this program and now that's it. But I actually want to do more longer-term tracking and understand what happens for that person in 1 year, in 2 years, and not to be like a big brother tracker, but to be a, did we succeed at providing the service type of tracking? If that person was experiencing homelessness, if they go into treatment, they sure better not be coming out of treatment and still be homeless and not have a housing opportunity. If that person has other complicated health issues, they sure better be getting access to that primary health care. And so I think it's also looking at the auxiliary services that are also the responsibility of the county to make sure that that person is getting that full wraparound. They're a whole person, they need whole person support. So I really want to see that happening. And then I also want us to use the data to be informing us of where we need to increase investments. I think we have far too many people still who could qualify for Medicaid and don't receive it. And I frankly also want to know how we can work with our private providers to get people who with Medicaid into those services. They often don't accept that insurance, and that's a conversation we need to start having.
Thank you, Shannon. Megan, you're up next. You have 2.5 minutes that begins now.
Yeah, I strongly agree with what Shannon's saying. And I think we have to be committed to making sure that deflection is, in fact, a gateway to treatment. And for me, my North Star when it comes to building a comprehensive, functional addiction treatment system is to make sure that we have the right treatment for the individual on demand. And what on demand to me means that you're connected within hours. And it requires that we make sure that we've got a variety of services, and that next step from whatever the first intervention is to the next one also has capacity. Right now, people wait days. About 50% of people who show up every morning to get into detox are turned away. Once you get into detox, if you're lucky, you complete that. People cannot get into inpatient from that, and in fact wait weeks. That is a totally dangerous time period that is both dangerous for the individual because of an increased risk of overdosing, but also, again, we don't want gaps. We want to be there for somebody because their likely outcome is better when transitions are seamless. And then we got to commit to people to make sure they have housing, to make sure that they get ongoing supports. I view the role of the county is to be a support system for at least 2 years through somebody's recovery journey. And if they need to start over, that's okay. Because many people go through recovery multiple times. We don't give up on people. There is always another chance, and people really do recover. And I want that promise to be real. I don't want to talk about treatment and then say, bye-bye, have good luck. And right now that is our reality. And I'm passionate about making sure that when people say yes, we are there for them, and we're there for them through their whole journey so that they can then live a full life and be an inspiration to others.
Great. Thank you so much. Now, next up is Vadim. You'll have 2.5 minutes.
Yeah, that's an excellent question. Some of the answers equate drug addiction with homelessness, but that's not the case. There's a lot of brothers and sisters and children out there that are dying. 750 people died of overdoses in Multnomah County last year. This year, we're going to set a new record, probably over 1,000 people, because of how strong fentanyl is, methamphetamines to an extent as well, and other opiates. And so we need to make sure that we get the results that we need. A lot of people probably listening to this know of somebody with a drug addiction problem, have neighbors with somebody with a drug addiction problem. We need to get the results. Nobody wants to put individuals into jail. This deflection program, though, is an opportunity where we get people into a system where they get care from beginning, where it might be drug detox, where it might be providing an alternative to opiates that allows them to stay off of street drugs. Those are the kind of things that we need to make sure are successful. And so how do we do that? You're absolutely right in the questions. We need to keep track of data. The county's been terrible at keeping track of data. They have really nice reports with big fonts where it makes it seem like a lot is being done. But we all know when we walk around outside, when we look at the newspaper and see how many deaths are out there, that we're not doing a good job. And so the devil's in the details, and we got to make sure that we face that. So we need to have an audit of all that, where we provide the data to people to understand what's going on and look at it, whether it's demographics, age, and racial makeup, immigrant status, all those things, to understand what is working best for each individual and what is working best for each group. We all know one size does not fit all. And so we need to focus on what is working best. It's going to be a little rough. We're already seeing that Deflection Center is about a month behind schedule, over a month behind schedule. But a deflection program can work. We know it's worked in other places like Seattle and Hawaii. We know that we can make it work here as well, but we got to keep track and make sure that our children, our sisters and brothers are taken care of.
Great. Thank you so much. Sam Adams, you have 2.5 minutes beginning.
Thank you. So I'm going to focus my time on the how. We have a pretty good general understanding of what we lack, what's missing, what's needed, what's not funded. And yet, when you look at the Home Forward budget, when you look at add the City of Portland budget, and you add Multnomah County budget together for homelessness related services, for substance abuse related services, for behavioral health services, and for affordable housing, which needs more money. So I'll set that aside in this answer. That adds up to about $700 million this year. And my goal is, but it's being budgeted and being managed in sort of a scattershot way. And it doesn't lend itself to efficient and effective use of what is a massive amount of money, and the public knows that because they pay higher taxes. They know that a lot of money is going into this, and as Vadim said, they're not seeing the results on the street. So if you go to multcoforsam.com, you can see sort of a detailed comprehensive plan that I've laid out to, one, that the city's home forward, and the county appoint a homelessness czar, and that czar brings the pieces together around the table and creates a unified budget, looking for the gaps, the overlaps, looking for to reprioritize, to fill in with resources some of the missing pieces, the missing follow-on programs that you've heard from those that have answered this question before I have. So a czar that is empowered by the three big organizations, governmental organizations. 2, a unified budget. 3, a single care tracking system. Audits talk about homeless people have to apply 4 times or more to get the full benefits that they receive. You know, if our goal is to functionally end homelessness, we're going to need a care track.
We ran out of time again. I apologize. Thank you very much. I really don't, I feel very awkward doing that. I apologize, but we have to keep time. So we're hoping that the chat is open so people can see the little prompt that, hey, wrap it up. Anyway, thank you. Thank you all for, thank you, Sam Adams, and thank you all for your responses. Question 3 has come up actually a little bit tonight, so I think this is great. There's been tension, it's fair to say, between Portland, the city of Portland and the county in recent years. I think we can acknowledge around the Joint Office of Homeless Services, around other issues like deflection, issues that have come up already in this forum. If elected, how would you work with your partners in the city of Portland to overcome kind of like what I think county residents view as bureaucratic hurdles to ensure that desperately needed resources and policies are delivered effectively, efficiently, and equitably across the county? We're going to start with Megan this time. And Megan, you have 2.5 minutes.
Yeah, I think it is essential that we get on the same page, the county and the city get on the same page how we are defining success. And I've talked about this in a couple of ways, that I would like to move to a definition of success that measures at critical points. So it's not just, did we get somebody into a shelter? I want to know, one, what did we initially get somebody to engage? Most likely it will be some sort of emergency housing situation. Where are they in 6 months? Because I think that really does help us decide where we're investing. Have they moved on to the next step in their journey? It could be, are they now engaged in residential treatment? Are they in a more permanent housing situation? Have they started, job training or whatever is right for them? But I want to be looking at 6 months, 12 months, 24 months. And to me, ultimately, true success is, where is somebody in 24 months? And I think that's particularly appropriate for the county to be looking at that. I get that the city's role really is different. And I honestly think part of the problem is not having clear ownership of who does what. And when people know what they do and see it as part of a full system, and they have signed off on that system, and they have signed off collaboratively on what our end goal is, then I think you can have better accountability. I also want to be honest, I think we have to empower the staff we hire to do their jobs. I think there has been too much micromanagement on an elected level. We need to hire excellent people, and we need to give them the freedom to do their job. That does not mean we don't hold both staff and contractors accountable. Of course we should. Data is crucial. You always have to be open to adjusting strategy, seeing where need is changed. And I want strategies by subtype of population. What is needed for a family that is having an economic crisis is entirely different than for an individual with untreated serious mental illness, which is of course different for a youth. And I think we've got to get granular in strategy, and we've got to be able to serve people and their individual needs.
I think we reached time. I'm sorry. Thank you. I cannot tell you how much I hate the muting. I know we have to do it, but feel impolite. But thank you for your response. We're moving next to Sam Adams. Sam Adams, you have 2.5 minutes, please.
Yeah, I think getting folks on the same page is a really important goal, and I think a functional end to homelessness, having the same actual goal is key. And then the sort of smaller building blocks of goals adding up to that. But there's got to be an agreement on for the city and the county that a functional end to homelessness, which means that no more people are becoming homeless than are leaving homelessness, and that homelessness is rare, infrequent, and doesn't last very long. I think in addition to that, there needs to be one staff person in charge. And that's why my proposal to have a homelessness czar is important. I also would point out, having worked in the city recently, that the city and county have distinct responsibilities, but it isn't always the case that the county has sort of embraced the fact that the city has to do this sort of time, place, and manner work. Since 1917, outdoor homelessness has gone up 130% since the joint office was created. The number of shelter bed spaces has not gone up in a commensurate amount, which means we've had so many more people experiencing homelessness on our streets, and the city has been left to sort of figure that out on its own. We came up because the dorm style traditional county shelters weren't working, so we in the city came up with a new model in terms of outdoor shelters, both the villages and also the task sites. So there's got to be one person in charge. That person needs to have matrix authority into the city. That person should be housed in the county, and it all needs to work together in a seamless system. I didn't get muted this time, barely.
I'm excited. Thank you. Thank you very much. Now we're moving on to Shannon Singleton. You have 2.5 minutes.
Thank you, Julia. So if elected, how would I work with the city partners? I think it's a question I hear a lot while I'm out talking to voters and neighbors on the street. I think really for me, it is about us putting our egos aside and actually serving as elected leaders that we are meant to serve our community. I think there's a lot more shared values across elected leadership. And so I think it's reminding ourselves what those values are, and then agreeing to disagree sometimes without being disrespectful to each other. I have had to have that track record of working with people who I don't agree with everything on. And I would expect to bring that same quality and skill set to this work. An example would be the negotiation of the Rose Quarter Compromise that I was able to facilitate, where parties weren't agreeing, and how could we really find a way to move forward in ways that best served what the community wanted. And that's what we have to do as elected officials, is put our stuff aside and figure out how to best serve what the community wants. Additionally, I would say I am very hopeful. I have had amazing conversations with city council candidates across the districts. And there are a lot of people who have the same opinion. They want to really get to work and want to approach this as a partnership between jurisdictions. And I don't think it's just between the city of Portland and Multnomah County. We have to be working with our East Multnomah County cities as well. We have to work with Metro, and we have to work with our neighboring counties to really look at the regional needs that we have and ensure that we're all rowing in the same direction. And frankly, I think we have missed a lot of opportunities to leverage resources. So I'd really like us to think about that, not just looking at the state or the federal government, but even just locally here. How can we work together to make the most impactful change?
Thank you, Shannon. Next up is Vadim Mazursky. You'll have 2.5 minutes.
And Julia, let me just begin by saying thank you for muting us at the correct mark. You know, the people that are viewing this came here for an hour. We have a bunch of politicians and wannabe politicians here. You give us an hour, we'll talk for an hour and a half, if 2 hours. So I appreciate you keeping us on time. I got a little baby that I need to have dinner with and put her to sleep. So I once again, I appreciate it. Getting back to the question about how we can work together better, and that's about experience and trust. I'm out in the community a lot. I'm out in neighborhood associations. I'm out at street fairs. I'm out at farmers markets. I'm out at faith-based meetings. I'm there to talk to people, to understand where they're coming from, what their needs are, and to build that trust, because I want people to be able to email me, to call me when they need some help, and know that I'll respond. And the same thing for the elected officials. I've worked with our current city council in various formats. I've been appointed by them to various committees overseeing the police, community involvement in the police, as well as the Disability Commission, and most recently the Charter Commission. I've been appointed to those because I've worked with them in various capacities, and I will continue working with them in various capacities. I've worked with Mingus Maps, and he has endorsed me. He's running for mayor. If he wins that, we'll continue working together. I've worked with Renee Gonzalez on public safety issues, including the ambulance crisis that the county has unfortunately dropped the ball on for a long time. And if he gets elected the mayor, we'll continue working together. I worked with Keith Wilson on homelessness issues. If he gets elected to become our next mayor, we'll be working on those issues for sure, because that's exactly where the county has a lot of buy-in. And same thing with city council. If you look at my website, votevadim.com, numerous city council candidates have endorsed me, not because I gave them $5 or whatever, stuff is going around, but because we worked together in the past. I know these individuals personally. I've worked with them. We've built trust, and I will continue working with them to make sure that Portland and Multnomah County are successful.
Thank you so much, Vadim. Thanks, everybody. We got through that one with minimal muting, and I appreciate it very much. We're at our last question of the evening. We did really try to keep it tight, and we're going to reach time, which I'm very proud of. So the homeless population in Multnomah County has increased 65% in the last 10 years. This is important, of course, to our community because Black residents are severely overrepresented. They make up only 5% of the total county population, but are overrepresented in its homeless population at 17%. That's from the point in time count, but it's always been an overrepresentation. If elected, what is your plan to bring support, stability, and equity to finding solutions and resources for Multnomah County's most vulnerable residents? And we're going to start with Sam Adams. You have 2.5 minutes.
I think continue to invest in BIPOC focused organizations that can do the work related to homelessness, to do the work related to substance abuse disorder and mental illness and affordable housing. I think it's important that investments from the city and the county continue or ramp up, and that it be to those organizations that want to specialize, great, in pieces of this, that's great. Also to organizations that want to take a more holistic approach with their clients, then that's going to require prioritizing them for additional resources, which I would be willing to do. It's through this that it's through more community capacity that has more support, that's more stable, that we can support their efforts to find BIPOC-oriented solutions to these issues. And as important as anything else, to prevent homelessness. And so those are some of the things that I would pursue if I'm on the board.
Great, thank you so much. Next, and that's Sam Adams is District 2. I meant to say that throughout the whole thing and I forgot. District 2. Thank you, Sam Adams, District 2. We're moving to District 1. Vadim Mazursky, you have 2.5 minutes.
Thank you. And I'm in agreement with Sam on a lot of this. We have to make sure that we fund community-based organizations that have a specific skill set in working in their communities, because those are the individuals that will get results. You mentioned homelessness going up about 65% in the last 10 years. I think it's maybe even 7 years. In that period of time, the budget for the Joint Office of Homelessness has gone from $45 million to $400 million. We're just not getting results. We need to make sure that we're funding the individuals that know their communities, that can help out and get those results. And those are often community-based organizations. I'm asking for an audit of the Joint Office of Homeless Services. We need to find out where our money is being spent and why we have the inequities that we're seeing right now. Not only the rise in homelessness, the number of people dying in the streets, the number of people overdosing in the streets, but also the disparities in the different communities that are experiencing homelessness. And we need to address the problems early rather than later. I mean, basically, we're band-aiding a lot of things here by throwing money out the window, hoping somebody actually addresses it. We need to make sure that people don't get homeless to begin with. I'm a supporter of organizations like Word is Bond and La Cayana Jewelry, who is helping young individuals be successful older men and not fall into some of these trappings that can possibly lead to homelessness. I think those are exactly the community-based organizations that we need to fund so that we have the results that we need in making sure that people have jobs, build families, save, put their kids to college, and build generational wealth. So fund organizations that work community-based, but also encourage organizations that prevent homelessness so we don't have to face these same exact problems 10 years down the road.
Thanks so much. Megan Moyer, District 1, you have 2.5 minutes.
Yeah, I think seeing the inequities in homelessness is a little snapshot of, frankly, inequities in our community. And so when I think about how to address this, fundamentally, homelessness does track with housing affordability. And I think we've done incredible disservice historically to our BIPOC communities of not preserving neighborhoods, redeveloping in ways that price people out of their communities. And during hard times, when you have not been able to have generational wealth, you are more vulnerable to crises. If you compound that with other issues that our homeless population is experiencing, I mean, I can't think of a more dangerous situation than being a BIPOC man with a mental illness in Portland. I mean, our history of what police have done. If I had a BIPOC child with mental illness, I would be freaked out. We have never built culturally appropriate services. I was happy to support and believe that the county needs to play a role in increasing BIPOC providers, particularly in addiction and mental health services. We have to be really careful about what kind of background checks we require and if those are really the appropriate screen. I've worked a lot to make sure that addiction counselors who may have had a criminal background in their past are not disqualified. I actually had to pass a bill to stop a list of permanently disqualifying crimes because people do better in engaging in services and in recovery when they are delivered services by people who understand their lives and look like them. And it is the county's responsibility to make sure our service providers reflect our community of need.
Thank you, Megan. Last one, Shannon Singleton, District 2, you have 2.5 minutes.
Thank you so much. I think we just need to really state that structural racism is real, and it's something that continues to impact our community. The Black households in Oregon or in Portland continue to have the lowest incomes of any demographic, and that is absolutely atrocious. It has continued to go down in respect to other communities, and we must address that economic disparity as well. I think additionally, we have, of course, to continue to invest in culturally specific providers. It's something that I got to frankly watch as a provider and find ways to make sure that we were bringing in people who actually can provide that type of service and make sure they had access to money to do these programs and increase their ability to build programs to serve their community. Additionally, I would say we can't keep letting dominant culture organizations off the hook. I think that organizations have been required to write equity plans, racial equity plans, for almost 10 years now, and there is zero accountability to them actually implementing those or having outcomes that overcome these disparate outcomes that we currently see. That cannot continue. And I would say, when I was at the Portland Housing Bureau and running contracts, when we had people who were underperforming in my portfolio, we put them on performance improvement plans. And if they weren't able to meet what we expected of them, I recommended ending their contracts. I think we have to be willing to say, we're not going to continue to put money into places that are not equitably serving this community. So that's really where I would approach doing that and ensuring that we are starting to see these disparities be overcome, but I just can't emphasize enough how much we have to ensure there are pathways into family wage jobs for our Black and Brown households. We have a lot of opportunity with regional infrastructure investments. This is a time right now that we can get people into the pathway for union wage jobs, and we must make every effort to make those connections very explicit to our BIPOC communities. Thank you.
Thank you so much, Shannon Singleton, District 2. That concludes the question portion of the evening. So we're moving on to closing statements. This is really just an opportunity. If you feel like you really were prepared for this and you didn't have a chance to talk about it, you have 2 minutes to do so. So we're going back in another order. It's just fun. So we're going to start with Shannon Singleton. Shannon, you have 2 minutes.
Oh, back to back. Thank you. I just want to be clear, there's a real choice in this race for Multnomah County for District 2. And I, like many others, am really tired of what we talked about today and the inability to collaborate and work across jurisdictions. We must move past this finger pointing and really turn the page to move forward and become the community that lives our values. We need those leaders who can collaborate with people who disagree with them, to focus on our charge to serve our community and find solutions without ego, disrespect, or bullying. I know we can push against the status quo and politics of the past. I'm ready to do that from day one for this district and for the county as a whole. Thank you so much, Urban League, for putting this on. I know it's a lot of staff time, so I just want to send my appreciation.
Thanks very much, Shannon Singleton, District 2. Next closing statement is going to be from Vadim Mazursky, District 1. You have 2 minutes.
Thank you very much. This is normally part of the sales pitch here. I'm running because we need to change the status quo. I'm running on a platform of change, of accountability, of making sure we get results. I work as an administrative law judge. I've had a lot of history and experience working with the city and the county governments, and I'll get the job done. But taking aside that sales pitch, I just want to make sure everybody that's listening to this gets out and votes. We have a new voting system in Portland. It's kind of complex, especially for city council. And there's been a lot of places around the country where, the NAACP in New York City spoke out about how there was not enough information provided to people. So I'm putting aside all that, again, that sales pitch about my campaign, get the information. The NAACP with the Urban League, Coalition of Black Men, they're putting a lot of programs out there about how to vote, making sure that everybody's registered, making sure that people understand how you can rank people if there's any confusion about that. Churches are providing information about that as well, or people working with churches are providing information. So if there's any takeaway from this, please go out there and learn how your voice can be heard, because if you don't fill out those blanks correctly, your voice might not count. Thank you all very much for bearing with us through this lengthy, but not too lengthy, hopefully, debate. Appreciate it.
Thank you very much, Vadim. Megan Moyer, it's your District 1, and it's your opportunity for a closing statement beginning now 2 minutes.
I think we are at an inflection point with the county, and we have to make a decision about what we're going to do in this crisis. And I've never run public office before. I have been happy behind the scenes, building systems, effectively delivering services, but I felt called to run because I felt we had to have a sense of moral urgency, that we cannot continue to move at a glacial pace while people are dying. We do not have a functional mental health and addiction system that is preventing people from being able to be successful moving out of homelessness. We have people in our communities that are dying, and it is not okay that the county has not gotten it together in order to build functional systems. That is why I'm running. I have a track record of doing this type of work. I care very deeply about our community. I know we can do this. I would not be running if I didn't know that there were concrete solutions, but we have to believe we can do it. I believe these are absolutely fixable problems. I'm 100% dedicated to making sure that they happen at the county.
Thank you so much, Megan Moyer, District 1. And now final closing statement is from Sam Adams, District 2. You have 2 minutes for your closing statement.
Thanks. And thanks again to the Urban League, to everyone who put together this really well-structured candidates forum and really excellent questions. I guess in closing, I'll emphasize that my focus as a candidate, my focus as a lifelong public servant has been not the what, but the how. And I'm going to continue to focus on that, the fact that we have $700 million, and that's a conservative estimate that's being spent between the city of Portland, Multnomah County, and Home Forward on issues related to homelessness, affordable housing, mental illness, and substance abuse disorder. And we've heard tonight appropriately that there are a lot of gaps. There's a gap in services, there's a gap in systems. There is no strategy, there is no plan. And until we address that, I think forward progress is going to be really hard. We can't wait for someone else to solve this problem for us, to ride in on a white horse with a bunch of buckets of money. We have to dig into the money we have, which is a lot, and make sure that it's being spent not only for the taxpayers, but especially for those that are most vulnerable, that are hit and hurt the worst by this real mess of a process and a system, lack of a system that we have right now. So thank you all very much. You can go to multcoforsam.com to learn more details on all this. And you can always call me at 503-421-8925 with any specific questions. Thanks.
Thank you, Sam Adams, District 2. So thank to all of our candidates for your time and for speaking to our community tonight. As the forum comes to an end, I have to thank our partners at LNS Captioning. So they did live captioning, which as fast as I talk and as fast as y'all were talking after the muting, it was really a feat. And I want to also thank Open Signal. They air this forum and they help us with the live streaming, and they're just wonderful partners to work with. I want to, of course, thank all 4 of you for your participation tonight and for really speaking to us in our community. We want to also take this time to just highlight the importance of voting. It's a new electoral system. You can come and get help from the Urban League of Portland. We're a nonpartisan organization. We just want to make sure that people vote. The deadline to register is next Tuesday, October 15th. Probably a really small gap of people who aren't registered, who are watching, but if you are one of them, you can come and get help from us. Election day is November 5th. And really, we mean that democracy only works when people vote. So get registered if you aren't, and vote. At the Urban League of Portland, much of our work is done in concert with our local partners who have a deep commitment to our shared values. So we want to thank the following partners. This is going to be longer than 2 minutes, so don't mute me, please. We have Reimagine Oregon, the NAACP of Portland, Fair Housing Council, SEIU 49, Welcome Home, Coalition of Black Men, Kairos PDS, Muslim Educational Trust, the Women's Foundation, YWCA, Impact Northwest, Children's Institute, NEA, Latino Network, Northwest Pilot Project, and Self-Enhancement, Inc. All of those community organizations were involved in some way in our series of candidates forums. That is just represents the whole community. So we're so thankful that the candidates took the time to speak to that community. Please, in closing, please remember that the Urban League is a nonprofit that relies on donations and memberships to serve the community. And it's really through your generosity that Urban League of Portland can host forums and other events like this. Tonight's event was a part of an overall series about virtual candidate forums for the general election. We're covering a lot of the local, almost all of the local races. So if you missed one, you can go to visit ulpdx.org to learn more about the series. If you need assistance voting or registering during election season, we are ready to help. Reach out via our website, social media, or call us at 503-280-2600 for assistance. On behalf of our president and CEO, Nikenge Harmon Johnson, our board of directors, and all of our membership, we want to thank our audience for joining us tonight. I'm Julia Delgado with the Urban League of Portland. I'm our vice president. Have a great night. Everybody.